Hello, and welcome to another installment of the International Institute's Let's Learn About It series. Again, this program is brought to you by the Preferred Communities Program in partnership with the U.S. Committee for Refugees and the Office of Refugee Resettlement. Today we are going to talk about and learn about preventative health care. In this presentation, we are going to learn about primary care physicians, dentists, optometrists, obstetrics, and gynecologists. We are going to learn about the difference between specialty care and primary care. We're going to learn about vaccines or immunizations, as you may have heard them be called. And we're also going to understand why all of these things are important. What is preventative health care? To prevent something means to keep something from happening or a problem arising. When we say preventative health care, we mean health care that happens before a health emergency. Preventative health care is routinely seeing a doctor to make sure that you are your healthiest self. It means seeing a doctor, dentist, eye doctor, an OBGYN annually or multiple times a year depending on your needs. It is also keeping up with vaccinations to ensure your body can defend itself against certain diseases. It is also having blood work and other routine tests done to catch any problems before they get worse or before they grow. What is primary care? Primary care is your hub for your initial and basic healthcare needs. It is where you go for your annual checkup, medication management, minor illnesses or injuries, and referrals to specialty doctors. Your primary care physician, or PCP, helps you manage your health, prescribes medication, and can write you a referral to a specialist if needed. You should see your PCP at least once a year, maybe more if you need it. Again, a PCP helps with regular physical exams, prescribing medication, treating minor illnesses like the flu or a cold, treating injuries like a minor cut, burn, or broken bone, screening for health problems, and managing chronic conditions like diabetes or high blood pressure. A PCP can also help you with your emotional health if you find yourself feeling sad or having trouble with sleeping and eating. What happens at a PCP appointment? Once checked in and registered, a nurse will call you back into the office. There they will take your blood pressure, temperature, and oxygen levels. A nurse will also ask you for your medical history and if you have any problems or concerns. The doctor will then come in and examine you. Depending on your age and presenting issues, you might have to have your blood drawn or other tests done. Bring any medication you are taking so the doctor knows what you have. It is important to be honest with your doctors and remember you have a choice in what happens. If you do not understand something or have questions, ask. You might have heard the terms primary care or specialty care. If you have a certain illness or injury, you may need to see a specialist. That is someone who has special training in a specific medical area. In order to see a specialist, most health insurances require you to have a referral from your PCP first. An example of reasons someone would go to see a specialist is if they have cancer, HIV, TB, neurology issues, bone or joint issues, and many, many other reasons. You should always see your PCP first before going to a specialist. Some people think that you don't need to see a dentist unless you have teeth problems, and that is just not true. On average, everyone should try to see a dentist at least 1 to 2 times a year. It is important to see a dentist even if you don't have any tooth pain. Dentists can help detect gum disease, tooth decay, or other infections. You should also be brushing and flossing your teeth at least 2 times a day. At a dental appointment, a dental hygienist will clean and floss your teeth. These cleanings help reduce plaque buildup on your teeth and keep your breath fresh. A dentist will come in and examine your teeth. You might have to have x-rays, teeth removed, or other dental work done. It is important to let your dentist know if you are having any sensitivity or pain. Just like dental care, vision care is also important. Trouble with vision can cause headaches and make it difficult for us to learn and work. Everyone should see an eye doctor at least one time every year or every 2 years. Early treatment is important to prevent eye diseases that could cause blindness. Even if you have good vision, you might still need glasses. At a vision appointment, you'll be asked about your medical history and any medical problems you might have. An eye doctor will test your vision by asking you to read off of a paper and identify shapes or letters. You might be given numbing drops. This is called dilation. This will make it hard to see. The eye doctor does this to check your eye health and eye pressure. Similar to a PCP, individuals with female sex organs, or women identifying individuals, should see an OBGYN at least once a year. OBGYN stands for Obstetrics and Gynecology. People trained as OBGYNs focus on the female reproductive system. They can help with many things. Some examples are preventing and identifying cervical cancer, breast cancer, and sexually transmitted diseases, addressing infertility issues or difficulty having a baby, answering your questions about sex, preparing you for getting pregnant during your pregnancy and after childbirth. OBGYNs can help obtain contraceptives such as birth control and address questions about your menstrual cycle or female circumcision. Plus, they can do much, much more. At an OBGYN appointment, you'll be asked your medical history and any issues you might be experiencing. A doctor will examine the inside and the outside of the vagina as well as the breast to check for any irregularities or lumps. If you at any point are uncomfortable, you can ask them to stop. It is important to be honest with your doctor. If you have any concerns or questions, everything is confidential, meaning that it will be kept private. One of the last things we are going to talk about today are vaccinations. A vaccine is a tiny amount of a disease that is injected into your body to kickstart your body's defense system. Vaccines help prevent you from getting certain diseases, such as hepatitis A, B, and C, diphtheria, tetanus or whooping cough, polio, smallpox, rotavirus, influenza, chickenpox, measles, the flu, and many more. It is important for everyone to be vaccinated, especially children. Many schools require children to get certain vaccines before you can attend. USCIS requires you to have certain vaccines before you can become a lawful permanent resident and get your green card. Talk to your primary care physician about what vaccines your family might need. And be wise, immunize. Thank you for listening to this very brief educational series on why preventative healthcare is important. Please stick around and watch the next video available to you on the Let's Learn About It series. Thank you.